What do we make of all these new trials? I mean, it gets publicity because of someone like Fiona Phillips being involved in this, but how much progress are these trials making?
So clinical trials is a really exciting field. I actually work in clinical trials, but cancer ones myself. And honestly, I can't speak highly enough about the opportunities they give. The stats that you quoted there about how patients tend to do better is actually true. Trials give access to new treatments that are in the pipeline. So every existing drug that we give has had to go through this trial process. And also patients get a lot of surveillance on a trial, so they get regular follow-up with a clinician and specialists in the field. With this particular trial, it's still in the early phases, so it's an early phase 2B trial. It is randomised, which is excellent, and it is going on. I think they've got 43 patients in this country, but patients are still on it, so we don't have the results of it yet. When the trial reads out in the next couple of years, we'll know more about whether the drug's effective at slowing down the progression of Alzheimer's and indeed reversing some of the symptoms, and if it's safe and tolerable for patients. What I think's really important is that investment and research is happening in this space. There's been quite a long lag in research in the Alzheimer's space. Working in cancer trials, we have new trials popping up all the time. But if you look at the Alzheimer's timeline, there was a kind of 20-year lag with no new treatments. So I think this is really promising.
Yeah, I mean, Fiona has to be credited with so much of the marvellous work she's done campaigning about Alzheimer's, because both her parents, I think her uncle as well, many members of her family have been haunted by this horrible disease, and now she's clearly got it herself. And she doesn't appear, as far as we know, she doesn't know whether she's on the drug or on the placebo. She's praying that she's on the drug, but even obviously all of the specialists she speaks to, they don't know how successful this will be. But are you saying that the sheer fact that you're on a trial, your outcome is likely to be better, even if you're on the placebo?
Yeah, there's some thought that, so in this trial, just for people watching, the patients are randomly allocated to either receive the drug or a dummy drug, which is a placebo, and they don't know which one they're getting. So it's administered in the same way. Both the patients and the clinicians are not sure, and that ensures that we reduce bias in trials. But the actual process of a trial means that you've got regular follow-up in a hospital, you have lots of regular tests, and patients on trials become really good at, being aware of their health, reporting all of the symptoms or side effects they've got, and in general, improving lifestyle factors, because they are wanting to do everything they can to improve their outcome. So in general, it's all that patients on trials do better regardless of which drug they receive. Obviously, we hope that the patients who get the trial drug do better, because that shows that the drug's effective.
Yeah, no, it's really interesting. Frankie, we've got to leave it there, a bit tight for time. Thanks very much indeed.